Mark was diagnosed with leukemia at a well baby checkup. The doctor felt that his liver and spleen felt enlarged. The doctor called and wanted us to go back to his office with the baby, and when we got there, he had a lot of paperwork ready and sent us down to AI DuPont Hospital and wouldn't really tell us why, but I knew there was something terribly wrong. He was very upset himself for a doctor, and we drove there, and it's completely terrified. She sat us down and said that Mark was very, very sick and that he had an aggressive form of leukemia, which was infant leukemia, and that he needed to be treated right away and he needed to go to the intensive care unit. I said to her, "There's nothing wrong with him. I mean, look at him. He's a healthy baby." And she said, "He's not a healthy baby." And the roller coaster ride began.
Mark was diagnosed with acute lymphocytic leukemia when he was less than 2 months of age. That group of patients historically has the absolute worst prognosis for surviving leukemia. And his survival is really a miracle because he was as sick as he could have been, many trips to the ICU. He required the support of many subspecialists to treat his infection, to treat his inability to take food by mouth, to treat all of the complications of this. People say to me, "How can you do this? It is so depressing to take care of children with cancer." And I say, "But I have the possibility of helping a child have 75 years of a normal life."
Well, right now I play varsity ice hockey for my high school, and I mean, that's awesome. I love it. Play club ice hockey for the Hawks. Always busy, I'm always on the run. My friends, I have a great group of friends. I mean, I'm so lucky because they're always there for me and I'm always there for them.
Mark is a normal teenager. And because he's a normal teenager, as his mom, sometimes I want to brain him, but he is a normal teenager doing all of the things that a teenager does. And he really has grown into a really nice young man. I know that there is something inside him because of all the things that he has done at the hospital, all the kids that he has encountered. We were at the hospital for a party not long ago, and the social worker asked Mark would he be okay to go in and see a boy who was the same age as him that was going to lose his fight very soon, and Mark said, "I'll go in and see him." And Mark went in and, we stood at his bedside. He had some friends there, the boy, and Mark talked to him, and he's really brave like that. I just think that it's just part of who he is. I know he doesn't remember any of the treatment, but it still has defined a lot about who Mark is.
When I started treating children with cancer 40 years ago, the outcome for children with leukemia was perhaps a 50% survival. And now that outcome, if you look at all children with leukemia, is probably 85 to 90%. And we're talking about survival of children who go on to have normal lives. And that is a tremendous change in the outcome for children in this country.
Donations supported the cutting-edge research that saved my life. When I visit kids in the hospital, I try to offer them and their parents hope. Walk out praying that they'll be cured, like me. If we can save just one more kid, won't that be worth it? Please be generous. Please help.